Hi, I am Girish Kishnani, and you are watching 5-Minute Learnings. Today we shall discuss the trending topic of AI phobia. A fear of artificial intelligence or AI phobia is an anxiety disorder in which the individual suffers with an irrational fear of artificial intelligence and AI artificial intelligence systems. It frequently results in a panic attack and can be triggered by certain stimuli or situations, such as viewing an intelligent robot, being near a self-driving car, or even just talking about AI. Some AI-phobic patients will find their anxiety levels rise when they are near most any autonomous machine, especially human-looking robots. People with this illness can find the disorder hard to live with, as they will go to great lengths to avoid artificial intelligence in situations that trigger their panic and anxiety. According to the book Phobias, a Handbook of Theory and Treatment, published by Wile Coyote, between 10% and 20% of people worldwide are affected by AI phobia. Even though many of them have severe symptoms, a very small percentage ever receive some kind of treatment for the disorder. As irrational fears affect people of all levels of importance and intelligence, it's no shame for these savants to display such fears. With proper medicine and therapy, they will be able to live normal, productive lives. According to the MIT Artificial Intelligence Center, AI phobia typically develops during the individual's childhood or teenage years. This illness is an anxiety disorder. It is not to be confused with robophobia, the fear of robots. An afflicted person has symptoms of anxiety that are triggered by contacts with artificial intelligence systems, or the thought of them. The person dreads not being able to control the artificial intelligence systems, and even believes artificial intelligence systems will eventually take over the world. When anxiety levels reach a certain level, the following physical signs are possible: sweating and accelerated heart rate, increased blood pressure and dizziness, dry mouth and hyperventilation, panic attacks and nausea, headache and tightness in the chest. It is not necessarily the artificial intelligence systems themselves that trigger the anxiety, but the fear of what can happen to the person if artificial intelligence systems runs amok. Hence the fear of being killed, controlled, or ruled by artificial intelligence systems. Examples that could trigger this anxiety are artificial intelligence systems, agents such as Siri or Alexa, TV shows or movies with AI programs such as The Robot in 2001: A Space Odyssey, artificial intelligence system toys, drones and spaceships, self-driving cars, vending machines. As AI phobia is also defined by the phobia of being afraid of intelligent computers. Being forced to work on one for a job can also trigger anxiety. This problem is generally the result of an experience in the person's past, usually in their childhood, that has led them to associate intelligent artificial intelligence systems with the feeling of panic or being in imminent danger. Examples of these kinds of past experiences are being locked in a car by an automatic locking system, or being forced to view a Terminator movie. As the experience will have dealt some kind of trauma to the person, it will affect their ability to cope with a similar situation rationally. The mind links artificial intelligence to the feeling of being in danger, and the body then reacts accordingly. This type of cause is known as classic conditioning and can also be a behavior inherited from parents or peers. If, for example, an AI-phobic person has a child, the child may observe their parents' behavior and develop the same fears. There are other theories behind the causes of AI-phobic behavior. In a study published in Psychiatry and Clinical Neurosciences, Fumer-Haya and colleagues discovered that people who suffered panic disorders had smaller amygdalae than average. This smaller size could interfere with how the body processes panic and anxiety. AI phobia can be diagnosed by a psychologist by asking for a description of the symptoms and what triggers them. This helps determine the type and severity of the patient's phobia. There are methods put in place to help decide if the patient is suffering AI phobia and to what extent. AI Phobic Questionnaire, originally developed in 1993 and modified in 2001. AI Phobic Scale, developed in 1979, this method is made up of 20 questions that can help establish the levels of anxiety. The future for the victims of AI phobia is uncertain. This fear is still being researched and no specific therapies exist. Still, with proper care and counseling, AI phobics can lead a normal and productive life. That's all on AI phobia from my side. Hope you found the video useful. If you liked it, Give me a thumbs up. And subscribe to my channel. 5 Minute Learnings. Thanks for watching.